Hi, everybody. This is Betsy Wurzel, host of Chatting with Betsy at Passionate World Talk Radio. Jeanne White is the producer and writes the blog. And I am so very excited to have a special guest with me today. I'm excited about the information my guest is going to share with us. And if you are a senior citizen, which I am one, and proud of it, you're going to want to get a paper and pencil because my guest is going to have some very interesting information for you. I want to introduce Jeanne White, Vice President of HealthInsurance.com. I hope I pronounced your name right.
You did great. Thanks so much.
Thank you. Thank you for coming on Chatting with Betsy. I'm so fascinated with your company. Could you please tell us what your company does? Because I'd like to hear more about it.
Sure, absolutely. At healthinsurance.com, we are an online marketplace for health insurance options. So someone who is searching for a Medicare Advantage plan, someone who's looking for a dental, telemedicine, pet insurance, we have life insurance available, cancer insurance, all kinds of great options for folks who are looking for insurance, and they can buy it online. We also have a phone number there, and you can speak with a customer service representative if that makes the person feel more comfortable. So it's a great resource full of lots of information about all of these plans so people can research and then decide if they want to buy or not. So it's a great opportunity.
Could you please give the phone number, Jeanne?
The phone number, just one second here. I don't actually have it memorized.
That's okay. I don't know my work phone number. I have to.
Yeah.
I don't call it.
Yeah,
no,
that's okay. It's 866-955-0898.
Thank you.
Get someone in touch with a representative.
Because I know not everyone, does have a computer or shops online. So if somebody is on Medicare, they can contact your company to go over different Medicare plans, and they could do it via online. Do you mean Zoom or just, look at a screen or both?
Yeah, so they can look at a screen, just like, for example, like you could buy something on Amazon. You can buy health insurance just straight online, or you can call in and speak with a representative over the phone, and they can walk you through everything.
And I really was interested when I was reading the information about your company that seniors are getting more into the telecommunications, Facebook, and doing more events online, Facebook time. Do you see that really exploding in the future, especially with the pandemic now?
One of the biggest things that we've seen is an increase in the use of telemedicine. So that's an easy example of seniors before the pandemic basically weren't using telemedicine. We ran a survey before the pandemic and said how many seniors are using telemedicine. About 10% had used telemedicine at some point. And then with this recent survey, what we found is 43% of seniors have used telemedicine. And that actually corroborates with a study that just came out from the Department of Health and Human Services. And, they're over Medicare. CMS is over Medicare. And what they've found is that before the pandemic, basically 0% of the office visits were by telemedicine, where now 43% of office visits are conducted through telemedicine. So what we're seeing is that seniors are saying, you know what, instead of going into the office, sitting in the waiting room, being around other people who may or may not be ill, I have to be there for, when I go to the doctor, I wait a half hour to an hour for the doctor in the waiting room, and then I wait in the room itself for another 15, 20 minutes, and you're just exposed to a lot of things. So instead of going into the office, people are taking the opportunity to do a telemedicine visit, which means that they talk to the doctor over the phone. Medicare was recently expanded by the Trump administration to allow all of this. And so some of the seniors are even talking to the doctor over their tablets, over Zoom and Skype, so that they can have a video experience. And, with a 43% of office visits now are, over telemedicine, I think that's an extremely interesting story of how seniors have embraced technology in a very short period of time. And one of the best things about it is that you can stay home. You can be safe. You can do it from the efficiency and convenience of your home. You don't have to wait in an office out for an hour. The doctor comes right on time. Like, that's amazing in and of itself, right? So
yes.
I've never had a doctor be on time before.
Neither have I. And I could tell you, Jan, from my own personal experience, my husband had Alzheimer's. And I can tell the listeners, to get my husband up the stairs, into the car, out of the car, into the doctor's office, especially as he progressed, it was very difficult. And I wish that they had this when he was alive, especially his last few months, because I could have just done the telemedicine, on the phone.
Right. Right.
And
well,
so,
it's really good for routine matters, right? So if someone is a diabetic and they know what they need, they just need a check-in, the doctor wants some eyeballs on them to make sure the prescription is going well. That's a perfect situation for telemedicine. And in that way, it keeps the doctor's office safe, it keeps us safe, keeps us at home. When telemedicine isn't the right solution is when you have a new diagnosis, if you have acute care, the doctor says, I need to see you in person. But for routine matters, my goodness, that's so much effort to get up and go to the doctor's office and expose yourself at the same time. So I think it's very exciting that it's finally come about. Telemedicine has been around for a while. We've just not embraced it yet, and now we are. So this is one of the things that I see as enduring beyond the pandemic. Now we've gotten a taste of it. What do you mean I don't have to get up and spend half my day at the doctor's office? This is fantastic. So I think it's going to continue. I think the federal government is going to, and each state is going to extend the allowance of telemedicine. And so I think this is one of the positives, one of the silver linings out of the terrible pandemic that we've had.
I can see it just growing and not stopping, because people don't want to get out of their house. And some people might have even gotten a little spoiled with that. Oh, I don't have to go out of my house. I could just call, if it's a routine. And even when the pandemic, was in high gear in the beginning, they didn't want you in the doctor's office.
That's right. That's right. In our survey, we found that seniors, I think they're a lot more tech savvy than what we've been giving them credit for. So what we found is that 9 in 10 seniors said that they have a smartphone and they like to use it. 90% of seniors have smartphones. When we think about the senior population, I think we need to adjust our mindset. We may have been thinking about those who were our grandparents, but people who are grandparents now they're just not the same generation. They've learned to use technology. So 90% have a smartphone and they use it. 71% of seniors say they prefer to text or talk on their cell phone rather than use their landline. So if you want to talk to a senior, you text them, call them on their cell phone. They're tech enabled, which translates back to using telemedicine. And if you have a smartphone, you can video chat, you can FaceTime, you can do those things. And so, this is very interesting to me that the seniors are so tech enabled and are learning. They're growing with the technology, and that's a different perspective than what we have had of seniors in the past, I think.
Yes, I agree. My mom, for instance, she brought a smartphone before I did, which I thought was pretty funny. And then I brought us. Wasn't that funny? But she doesn't know how to use a lot. But, God bless my mother. She's 90 years old. She just wants to dial a phone and look at pictures, maybe go on Facebook, once in a while. I'm 62, and I'm getting much better with the technology. And I think it's a great way, especially now when people can't travel, that they can FaceTime their grandchildren or their children and their parents, and they can see each other, because that's really what's going on with visitation with nursing homes. They're not allowed to see their loved ones, so they Skype and FaceTime. It's not the same as a personal visit, but at least you're seeing them.
Yeah, absolutely. My parents are 78, and we live in the same area, about 30 miles apart. And they just missed my small children. I have a 3- and 4-year-old daughters, and so my mom went online to buy an iPad because she's got a smartphone, she's got a desktop, but she didn't have FaceTime. So she goes online to buy an iPad, and she's figured out how to use FaceTime so that she could FaceTime with my little girls, so she was motivated. Absolutely. I'm going to get there, and I'm going to talk to my grandchildren. And, that they laugh and they tease and they say nonsense, but it makes my parents so happy to have that interaction. And, where, you could just be isolated at home by yourself. Why not, make a little effort and communicate with the grandkids. So I think it's lovely. It's a big change from what we've had in the past, and I think that's a really good thing for our senior population. Yes,
because they can keep in touch and see their children and grandchildren. I agree.
Yeah.
Jeanne, does your company help seniors or other populations with like a life alert system where they can get somebody in an emergency, doing it on a computer screen or smartphone, where they could say, hey, I need help, and like I don't know what you would call it. I've heard a life alert, but I don't know if your company has something like that.
Yeah, so some of the plans may have those types of benefits embedded in the plan, where you can buy a Medicare Advantage plan and they have extra benefits like gym memberships and things like that. And so it's just important to ask what all is included in the Medicare Advantage plan. It's interesting that you kind of bring that up, because seniors with life alerts and with hearing aids really were the first group to adopt wearable devices. A life alert is a device you put around your neck and you push a button and it sends a signal out. A hearing aid is something you put in your ear that is a technological tool that augments hearing. That's technically a wearable. We think about Fitbits and Apple Watches as being the first wearables, but they're really not. Seniors were really the first ones to adopt wearables. And what's interesting is that we have seen in our survey that seniors are very interested in wearables, and about a third of them use a wearable today. So a third of seniors wear a Fitbit, an Apple Watch, something like that. And 40% are interested in wearing some sort of a wearable device that would alert them if someone was not maintaining appropriate social distance around them, like a 6-foot radius radar that you could wear, something like that. So I think seniors are interested in these wearable devices. I'm glad you brought that up.
Yes, I think it's very important, Jeanne, and I want to tell the listeners this. I think it's very important to have something like that, because if you live alone, and a lot of seniors do live alone, that you can have this device and somebody will come. I mean, how many times have you heard of people, they fell, they're on the floor for a couple of days, the police come, have to get into the house because someone called up for a welfare check, and they see someone laying on the floor. So I think that's very important. I mean, someone could slip and fall in the bathtub. You can.
That happened to my grandmother. She passed away at 97, but at 95 she was living alone and she had a stroke in her bedroom, and she refused to have more than one phone in the house, so she had a phone in the living room. She had a life alert. She refused to wear it. So at 95 years old, she has a stroke in her bedroom by herself. It took her 48 hours to literally crawl between strokes across the floor to get to the telephone to finally call someone, because my dad called her every third day instead of, and missed the timing. And she ended up, in very serious condition because of it. And so I would encourage every senior to have access in every room. If you don't want to wear a life alert around your neck, have something in every single room where you can contact people, because that is a very miserable experience. Just being stuck at home for several days with really in need of care and not able to get it.
Yes.
It's really awful.
Yes, and it happens, unfortunately. And I think with the baby boomers aging, which I'm proud to say I am one of them, that you're going to find more people living alone. They don't have children, maybe the children are far away. Maybe they don't have a relative to check on them. Maybe they might have a neighbor, but I really think that that's a great idea. Actually, when I get to qualify for Medicare in 2 more years, I have to think I'll be 63 in December, of getting that. I mean, I live with my son, but my son has special needs. I mean, he may not know what to do, even though I tell him, Josh, this is what you should do if I should fall. So that's something that I know I would consider, because I don't have anybody to, call, may not have anyone to call 911. What happens if my son isn't home and I fall?
Right.
So I think that's a great idea. Do you also, in your company, have tracking devices for people who get lost, people who wander away from their homes? Does your company have any device like that?
We don't ourselves. What we do is we sell the insurance plans of other companies, and so some of those plans may have those types of devices. There are plans that offer iPads for those who are diabetic and need constant monitoring, and they can use the iPad to help monitor their food intake and their weight and things like that. And so there's various plans that we sell from other companies that may have tracking devices like that. That would be really helpful, and that would be interesting. You're right.
I ask that because I'm an Alzheimer's advocate, and I have a support group on Facebook, and that's a big issue of their loved one straying from home. My husband just had an ID necklace. I mean, he wouldn't have known to press a button. But now I know how technology is advancing. There's something that could be put in their sneaker, or maybe something on their wrist that they can be tracked.
Sure.
Which I think is a good advice. So if somebody wanted to contact your company and they're not of Medicare age, but they want, say, long-term health insurance, do you have plans for that?
Sure. So what we have available on healthinsurance.com are Medicare Advantage plans. We have dental plans. We have telemedicine plans where you can pay a monthly cost and then have access to a doctor's. We have pet insurance. So a lot of seniors have pets, so we have options to cover your dog or cat. We also have cancer coverage that people can buy. That's Aflac cancer coverage. We have life insurance. And so there are, a variety of plans that are available for those who are under 65, or even if you're over 65 and you're interested in a pet plan or dental, we can help someone there as well.
Oh, dental plans. I'll have to check that myself. I have a
dental insurance is interesting.
Oh,
yeah. So
okay.
what's interesting in our survey, we found that folks really are sort of skipping out on some of their regular visits. So this kind of has something to do with their habits related to using the telemedicine, right? So they think that I don't want to go to the doctor's office. I'm a little bit concerned about being exposed. That has also translated into going into the dentist's office as well, and so a lot of people are postponing their dental plan, their regular checkup for their dentist as well during the pandemic, which, it can be okay for a little while, but you want to make sure you have your dental care. And so, more than half of seniors have put off a dental visit, which, can be concerning. And so we want to make sure that seniors are taking, their dental care as seriously as they're taking their health care and get the care that they need. And it might be a best idea to call the dentist and make sure that, whether or not they need to come in, or, maybe the dentist has really good safety protocols in place and the person just doesn't know, So I'd recommend that all seniors go ahead and call in and talk to their dentist before they continue skipping their regular appointments.
Yes, and I would suggest dental insurance plan because it is costly. As a matter of fact, I'm going to have to go online to your company and see what you have to offer for dental insurance myself, because right now I have what they call, it's not even dental assistance. I pay a prorated amount when I go to the dentist. I lost my health. Yes, I did lose my health insurance and my dental insurance when my husband turned 65. His company said toodaloo. And
sure.
A lot of companies, and it's sad to say, they are doing that to their retirees. They're saying at 65, you're on your own because of the cost of the insurances. So I was left high and dry. And I think, a company like yours, and had I had known about this company, 2 years ago, I could have went online and looked. So this is what, I do in Chatting with Betsy. I get informative people like you, Jeanne, from companies that come on, or, other sources so that people can know. Because sometimes we think, oh, yeah, people know this already. They know, we don't have to tell them anything they know, but that's not true. People don't know. And they need to be told what is available to them. I think your company sounds fantastic.
Oh, thank you. And what we're trying to do is we're trying to educate people. We're trying to make sure that everybody's aware of what their options are, right? So when you lose your health insurance, we have what we call a learning center, a resource center, where people can read articles. What do I do if I lose my health insurance? What are my choices? ACA plans, COBRA, short-term limited duration, or do I want to go without insurance? Which is depends on your situation, can be a scary idea. So you want to be educated. So that's a big component of what we do, is make sure everybody knows what their options are. And then they can learn about the different insurance plans, what they cover, what they don't cover, and then also help them to find out what fits their budget and what fits their medical needs, because everybody has different budgetary needs, different medical needs, prescriptions, all that good stuff, so they can make the right choice for them. That's really what we're trying to help people do, is just figure out what is best for me. And education is the biggest component of that, and so that we take that very seriously. That is very important. I have to ask this, Jeanne. Sure.
Because of somebody, I had to navigate my husband's Medicare supplement. So someone who is 65 or going to be 65, because they say you have to apply for Medicare 3 months before your 65th birthday. This is in the United States, because we're global. So this is for the U.S. That we have a Medicare program. So if I go on the government Medicare, now your company, do they help with the Part A, Part B, or do we go to your company for supplemental? Because I had to get my husband a supplemental.
Right. So we can help with Medicare Supplement and Medicare Advantage.
Oh, okay. Okay.
Yep. We help with those two plans. Mm-hmm.
Oh, okay. So then a person would come to you with their government A and B, and you would help them with their prescription plan to pick out and a supplement plan like the Medicare Advantage and different options.
Right, and we'll walk through what are all the available options, and what prescriptions do you have, who are your doctors. Let's walk through what networks are available to make sure that your doctor is if it's an important thing to you to have your doctor available, then we'll make sure that that's in the network. We'll talk through what are the prescriptions, because different plans would have different out-of-pocket costs associated with those prescriptions, and so we can research that for the person to help them find the right plan that fits their monthly budget needs.
That I'll tell you, that's important. That is so important to have someone to help you navigate this, because I'll tell you, folks, there's a lot. There's a lot of plans out there, and you have to go with what's best for your budget and your healthcare needs. Now, is there a fee, Jan, if somebody contacts your company and they want someone to go over different plans? Is there a fee for that?
No. Okay. Not at all. Nope, not at all. What's interesting is our senior survey, it came out that 78% of seniors research their Medicare options online. So they'll go out on the Internet and start searching to try to understand, what is best for me, what are my options, what are my out-of-pocket costs. And then from those 78% of people who are researching online, it's interesting that you don't have 78% of people buying online. It turns out that about 44% of seniors buy just straight using the Internet. They find the plan they like, they buy it on the Internet. 56% of seniors will actually then take the research that they've done and talk with an agent in person, or they'll call and buy over the phone, speaking with someone over the phone. So we still, the majority of folks still would rather, when it comes to the buying point, talk to somebody. And so, there's that reassurance that, I did my research. Do you have any different information that I missed, or anything that helps reassure me about the information that I got? So I think that's interesting as well, which is why we offer online and phone consultations, which of course are free, because we want seniors to be comfortable, and I think that's an important aspect of the buying decision. Yep. Definitely.
I can tell you, I really do wish I knew your company, because with my situation, my husband's situation, it was 2 years ago when he was 65, that they let him loose. And you know what? To be honest, I didn't think to look online. I really didn't. So this is great information to put out there, because there might be people like me who don't know that you can go online. His company just said, go to, I won't mention the name, but, we're working with this company and you'll get a discount. So, of course, you go to that company, but then I didn't research other avenues. I didn't research other companies because I didn't know about them. Yeah. And that's very important.
It is. 155 million people in the United States are covered by employer plans. So the majority of people who are, out in the workforce, they're covered by their employer plans. And they don't think a lot about health insurance, and they don't really understand how difficult it is for people who are self-employed or for people who are unemployed to find insurance and really understanding the different components. The average employer plan when you go on COBRA, which means you're no longer employed with that company and you're paying for it yourself, is $650 per month. And the reason it's $650 per month is because that's what the employer was paying for your health insurance plan. So those of us who have employer plans, we have really nice coverage. We have very robust coverage. Compare that to an ACA plan. The average ACA plan, Obamacare plan, is $400 per month. So, those are still very expensive plans, but it's not as expensive as maintaining that employer coverage. And so when people find themselves unemployed, they're between jobs, and they find out the prices for health insurance, they go, oh, my goodness, this really is significant. And then that's when sometimes folks start to do a little bit more research. There are plans called short-term limited duration plans, which are designed to help people who are between jobs. So someone who's relatively healthy, doesn't have a lot of prescription needs, doesn't have chronic conditions that they need covered. A short-term plan will cover someone for unexpected accidents or illnesses that happen while they have the plan. That plan will be around $100 per month. So that's really just intended to cover you, if something bad happens to you while you're between jobs. But those plans can last up to 36 months depending on the state. So you can spend between $100 there. You can spend $400 for an ACA plan, which is very good coverage, or even $650 to just continue that employer plan. It's like, wow, that's actually a lot to consider. So, I think there are a lot of people who are in your shoes who have had a plan by an employer and just really didn't know what those folks out there who are unemployed or self-employed are really dealing with. It can be very confusing, which is why, at healthinsurance.com, our approach is education, because there's a lot of information and it can be very, very confusing. So we're here to help.
You're absolutely right.
People out. Yeah.
Thank you. Thank you so much, Jeanne, for coming on Chatting with Betsy. Is there anything else that's on your mind that you would like the listeners to know about your company that we missed?
No, I think we kind of covered it. Healthinsurance.com is an online marketplace for folks to research and ultimately, if they choose, purchase health insurance for seniors and for those who are not seniors: dental insurance, pet insurance, life insurance, all kinds of good things. During the pandemic, we've all been very stressed, and I think that what we learned from our survey here is that seniors are rising above and they're embracing technology, and I think that's a real exciting opportunity that has come, a positive that's come from this pandemic. So I'm excited to see what happens next. I think seniors are going to surprise us, which is great news.
Yes, well, thank you so much, Jeanne. It was very lovely meeting you on the phone and talking about your company. As a matter of fact, folks, I'm going to go online because I want to check the dental plans. I really do. And I actually want to find out about the health insurance and compare it to what I have. I'm on the so-called Affordable Health Care Act. So I think I'll compare my own options now that I know that your company will help me. Excellent. Thank you.
Thank you, Betsy.
Okay. You're welcome. Okay, viewers, you heard the information. I'm going to check healthinsurance.com myself. I highly recommend that you go online and you can check it out for yourself. You have nothing to lose and all to gain. And I want to thank everyone for listening to Chatting with Betsy. If you missed any of this podcast, you could catch it on Spotify, Spreaker, iHeart, Google, and Amazon Alexa. It's free to subscribe. So I highly recommend that because I have people that come on that are very a good resource of education and learning about things. I mean, how important is health insurance? I mean, my goodness, I really do wish I knew about this company 2 years ago, and I'm serious. Because when your company drops you, You are scurrying. Let me tell you, I had to scurry to get on the Affordable Health Care Act, and you had to go through this whole big thing of proving that you were dropped because enrollment is only at a certain time of year unless you have an emergency, like your employer just drops you or you're unemployed. So I want to thank everyone again. I want to thank Jeanne White, Passion World Talk Radio, Lillian Caldwell. In a world where you could be anything, folks, be kind. Thanks for listening. Until we chat again, be safe. Bye now.